idea now is to talk about decompression sickness, also called the bends. This problem is quite similar in idea to the problem that happens in arterial blood gas from diving. The idea of decompression sickness is that when you are diving, according to Henry's law, what you will see is this principle. The concentration, C, of the gas in the air. There are many types of gas, but the main gas that we will discuss about is the nitrogen. So the concentration C of a gas is strictly and linearly dependent on the partial pressure of the gas above the liquid. And this is a constant of the gas and everything, which is K. What you can see that when I increase the pressure, I increase the concentration of the gas in the liquid, the dissolved gas. Specifically, when I'm talking about nitrogen, most of the air is nitrogen. So when I increase the pressure, when I dive, as you dive more deeply, the pressure increases. For every 10 meters, 1 atmosphere of pressure increases. So when I increase the pressure, I increase the dissolved gas in the liquid. In our case, in the blood and in the tissues. So when we dive deeper, we are increasing the pressure, and when we increase the pressure, we increase the concentration of the gas dissolved in the blood and in the tissues, especially nitrogen. The problem starts when we try to ascend. When we try to ascend, the pressure decreases, so the concentration of the gas dissolved in the tissue and in the blood decreases. Therefore, what happens? The nitrogen gets out of the blood and becomes again a gas, so it creates bubbles in the tissues, bubbles in the joints, bubbles in the blood vessels, and those bubbles can cause complications. In the blood vessels, it can cause arterial blood gas embolism, which can get to the brain sometimes, get to the pulmonary system sometimes, get to the cardiac, the kidney, the liver, the spleen, the mesenteric, in the abdomen, and cause complications in the brain. In the spine, the brain is the most, maybe the most. The pulmonary can also do severe, but the brain can also do severe complications, neurological manifestation like ischemic stroke. So when we ascend too fast from after we descend, we create bubbles. Those bubbles can cause complication. In the tissue, in the joint, it can cause only pain. In the skin, it can cause rash. But when it goes to the blood and goes to the brain, it can cause like stroke. And this is a very emergency situation. The treatment is immediate 100% oxygen and recompression therapy using hyperbaric oxygen therapy. There in the hyperbaric oxygen therapy, the patient is given 100% oxygen and it is compressed in a special structure to again high pressures. There he only breathe oxygen, sometimes for some stopping for breathing normal air, and slowly the pressure decreases. The problem is when the diver ascend too fast and doesn't let the nitrogen gets out of the system. So when the diver ascends too fast, the nitrogen, the gas, accumulates too much in the tissues and in the blood, and it can cause complications. Therefore, there are tables that tell you for how much time and for each depth that you went down in diving, when, where, and for how long you should do stops, what is called recompression stops, during your ascending from diving to let the nitrogen get out of the system. And when you ascend too fast, you are doing decompression sickness, which can also complicate to arterial blood gas embolism from diving. This is the idea. It can cause blocking of the blood vessel, rupturing of compression tissue, inducing endothelial damage, activating clotting. And the risk factors for decompression sickness, you can see here: cold, hydration, exercises after driving, fatigue, flying. Flying is very important because when you fly, you get even higher. You are getting to altitude. And in altitude, the pressure decreases. And you remember the formula I showed you of Henry, which tells you again that when you decrease the pressure, you decrease the concentration of the dissolved gas. And what happened to this dissolved gas that get out of the liquid? It becomes gas, and the gas can cause bubbles, and the bubbles can cause complication. The nitrogen gas can cause complication. You can now ask me, okay, but why do you give oxygen? Oxygen is also a gas, so it can do the same complication, no? So the idea is that nitrogen, in contrast to oxygen, nitrogen is inert. It doesn't get to, let's say, some, how can I say, processes in the body like oxygenation. And also the body have better how can I say it? The body can use and eliminate oxygen more efficiently than eliminating nitrogen. So oxygen is much more favorable than nitrogen, but most of the gas in the air is nitrogen. Now, there is toxicity for oxygen, and we won't talk about it, but you need to remember that there is oxygen toxicity. There is oxygen toxicity. So the 100% gas we give, the high pressure of gas we give in the recompression therapy might cause oxygen toxicity. Therefore, for example, in the recompression therapy, some of the time is devoted to breathing normal air. Most of the time is oxygen, 100% oxygen, but sometimes it's just gas from the air. You are breathing just normal air in order to prevent the oxygen toxicity. Okay, so decompression thickness have two types. The type 1 is much less severe, and the type 2 is much more severe. Type 1 involves joints, skin, lymphatics, and mostly cause things like painful joints or skin, mostly in the shoulders and elbows. Type 2 is much worse. It can cause neurological complication, cardiorespiratory involvement. You will see the chokes, which can be a very severe complication in the respiratory system. The spinal cord can also be involved. Even the spinal cord is the most vulnerable, especially vulnerable to decompression sickness. Respiratory can cause pulmonary embolism, heart failure, cardiogenic shock. There are many, many complications. Now, it can happen from minutes from ascending, especially the arterial blood gas embolism, or hours after ascending, some hours after ascending. The bands talks about joint or muscle pain. This is another name for decompression sickness. Decompression illness is the name that is given to uncomposed decompression sickness and arterial blood gas embolism. Now, symptoms as we talked, type 1 is the less severe, mostly joint muscle pain. Type 2 is much more severe, neurological manifestation, respiratory manifestation, ear trauma, and even it can get to death. The chalk respiratory decompression sickness may be very severe, but is rare. Shortness of breath, chest pain, cough resulting from pulmonary edema. Massive bubble embolization of the pulmonary vascular tree can result in rapid circulatory collapse and death. As you saw, we can talk about pulmonary embolism and things like this. Dyspareunia osteonecrosis is osteonecrosis from decompression, but it's less common in diving. Deep thrombosis in pulmonary embolism can also cause from the immobility of treating the decompression sickness. The diagnosis is usually clinical. Sometimes CT, MRI can help see some osteonecrosis and things like this, but it's arterial blood gas embolism, but it's not very precise. The diagnosis is mainly clinical, And usually there is no time for completing diagnostic tests, not MRI, not CT. The diagnostic is mainly clinical, and when you suspect it, usually the treatment should be given 100% oxygen, recompression therapy, and fluids. Okay, so until the patient gets to recompression therapy, 100% oxygen should be given to help increase the nitrogen gap, the nitrogen gradient between the alveoli and the blood and the tissue. This gradient helps the nitrogen gets out in the vector of the gradient, so we are getting him out. So 100% oxygen should be given immediately. And then the patient should be evacuated to a place with recompression therapy. And in the meantime, glucose-free IV fluid should be given, if but not delayed for this. So recompression treatment should be given for all of them except for the very, very mild manifestation of decompression thickness. Sometimes the patient should be evacuated as quickly as possible using air flight. Now, we don't really want the patient to get to the altitude because there the pressure is lower. If the pressure is lower, the concentration of liquid, based on Henry's law, will be lower. Therefore, will create more and more bubbles of the gas, more and more nitrogen bubbles, and we can complicate and make the situation worse. So we prefer not to fly the patient. Yet, many times we need to fly the patient to get him as soon as we can to recompression therapy. What can be done is aircraft that can get their pressure to 1 atmosphere is better. If it can't be done and the patient should be evacuated using flying, so low altitude should be done as, as best as you can to do to not let the pressure get too low if you fly the patient. When symptoms are mild, normal neurologic examination is stable for 24 hours, delayed recompression or evacuation by commercial airline is unlikely to worsen the local outcome. Okay. And remember that the patient may have deep vein thrombosis and pulmonary embolism, so you can observe for this and to do periodic ultrasound of the veins in the leg, the popliteal, the tibial, wherever you want to look for the deep vein thrombosis using ultrasound. Now, prevention, you should work, as we said, using ascending very slow, using stops needed to decompress the patient, not to ascend too fast. There are tables that tell you if you dive for this and this depth and this time, so we need to do this and this decompression stops in your ascending. If there's something that's called no stop limit, so if you are diving too shortly, not to depth, there are tables for each depth, how much time. Of course, as you dive more deeply, the time you can stay there without needing for decompression stops is reduced. But there are tables tell you, if even there are computers that calculate it, how much time, where and when you should do the stops and for how long is stop to decompress. Yet note that using computers for calculating this didn't really reduce the amount of decompression sickness. It did reduce the serious cases, but it didn't reduce the decompression sickness prevalence. Some patients, some guidelines also always almost use the stop in around 5 meters. Even if you don't need to stop, they tend to stop at 5 meters for any case. Okay? And diving when one day after the other before 12 to 24 hours elapsed increase the risk of decompression sickness because nitrogen is still in the body. So it's not really recommended to dive too frequently day after day. No, it's better not do that. And of course, not fly after diving at least for 24, around 24, 48 hours. I don't remember exactly, but this is around the time. Because flying will reduce the pressure, increase the gas creation based on Henry's law. Okay, so note that it's not always simple to differentiate between arterial blood gas embolism from diving from decompression sickness, yet the treatment is the same: oxygen, recompression therapy, sometimes fluids, and this is the most important thing, and as soon as possible. Okay, this was about decompression sickness and its two types. It may be very severe, it may be mild. It's a very important disease of diving. Remember the things, remember the complication, remember the manifestation, look for neurological manifestation. If it's severe, usually uh, starts minutes even after the uh, ascending. If the patient lose consciousness immediately after ascending, you can suspect this. Remember that oxygen should be given as soon as possible and recompression therapy be done. Thank you very much. If there are any mistakes or correction, please correct me. Thank you for making manual professional addition, decompression sickness. Thank you very much, and that's it.